Tragedy struck when Liam Payne, beloved former member of One Direction, passed away after a fatal fall from a third floor of Buenos Aires. His cause of death was confirmed as polytrauma, multiple severe injuries that affected various parts of his body. You may ask, what is exactly polytrauma? So, polytrauma occurs when a person suffers multiple traumatic injuries at the same time. This could mean broken bones, brain injuries, or organ damage, often caused by major accidents, violent assaults, or falls from great heights, in this case, for example. These injuries are life-threatening and need immediate medical care. Now you may ask, how is polytrauma treated? So treating polytrauma is complex. Few things I may suggest here is that first, the doctors focus on stabilizing the patient, securing airways, stopping bleeding, and maintaining vital signs. Next comes damage control surgery to repair the critical injuries. Recovery continues in intensive care, where every organ is closely monitored, but healing doesn't stop there. Is there a link between polytrauma and mental health? That's an interesting question. Polytrauma doesn't just harm the body, it deeply impacts mental health too. Survivors often battle post-traumatic stress disorder, PTSD, depression, and anxiety. Imagine facing emotional distress while also struggling with pain or permanent disabilities. The road to recovery is both physical and mental. This is why treatment must be holistic. Alongside medical procedures, survivors need psychological support, counseling, and sometimes medication to manage emotional struggles. Recovery can be long, but with integrated care, healing is possible. Understand the impact of polytrauma in few easy to understand ways. Number one, the immediate impact. When multiple injuries occur, the body goes into shock. Blood loss, severe pain, and oxygen deprivation can cause organs to start failing rapidly. The immune system becomes overwhelmed, increasing the risk of infections. Number two, the critical golden hour. The first hour of, after trauma is crucial. Rapid medical intervention during this period can significantly improve survival chances. Emergency teams prioritize stabilizing the vital functions, breathing, circulations, and controlling bleeding. Number three, complex surgical interventions. Polytrauma often requires multiple surgeries. Doctors focus on life-saving procedures first, such as stopping internal bleeding or relieving pressure on the brain. Less critical injuries are treated later. Number four, intensive care and monitoring. After surgery, patients are moved to intensive care units, ICUs, for constant monitoring. Machines track heart rate, oxygen levels, and organ function. Doctors must carefully balance medications and fluids to avoid further complications. Number five, the role of rehabilitation. Physical therapy helps patients regain strength and mobility. Occupational therapy aids in relearning the daily tasks. Psychological therapy is equally important to help patients cope with emotional trauma and anxiety. Number six, long-term challenges. Recovery from polytrauma can take months or even years. Some patients face permanent disabilities, chronic pain, or mental health struggles. Support systems and continuous care become essential for rebuilding the life. Number seven, the psychological impact. The emotional toll can be just as severe as the physical injuries. PTSD, anxiety, and depression are common. Trauma survivors may struggle with nightmares, flashbacks, and fear of re-injury. Emotional support and counseling are crucial for mental recovery. Number 8, holistic treatment approaches. Successful recovery requires team effort. Doctors, nurses, therapists, and family members all play a role. Mental health care is integrated with physical recovery to address the full scope of healing. Now, why the awareness matters? Well, understanding polytrauma is essential. It reminds us how fragile life can be and how important immediate and comprehensive care is for survival and recovery. By spreading awareness, we can help others recognize the seriousness of multiple injuries and support the need for mental and physical rehabilitation. Polytrauma is a powerful reminder of the body's resilience and the mind's strength. Recognizing both the physical and mental battles is the first step towards full recovery.